My name is Dung from Vietnam National University. Right now, I'm in UK for Horizon project, so it's early time in UK. I'm happy to present the things that we're doing right now. We call personalized healthcare platforms that is related to digital twin as well. So there are two issues that I want to present. First is a build core platform that we use for uh, personalized healthcare, and also could be used for digital twin development. As the next part is how the personal healthcare platform implementation is going on, and what we are doing and what expecting to do in the next future. So here's architecture that we call build core digital platform that could be used for any smart applications, including the healthcare. So you hear. It look like complicated architecture, but it consists of four parts. First one is IoT part. So that is a part of sensoring that collecting data from patient or the environment. And the next part is the communication networks that like internet. And the third part is very important. We call the core platforms that include the IoT for collecting the data, and big data platform that for batch processing and real-time processing data. And the third very important thing is the AI platform, that's the core platform that could be used for a different industry, including the healthcare platform. So basically, the twin distant twin system could be developed in this area based on the core platform. Um, so in the other view that we can see that how we can establish the distant healthcare ecosystem. So if you look at the left side, the important thing that we can collect, how we can collect the data. So on the left side, that's the solution we call data ingestion that collects the batch data, and for real time we call the IoT. So basically, is a solution available for data integration. And the next part is how to store the data. So we call the data lake platform. And the next part is the data processing that includes real time, math, and machine learning op or data ops. So that is the AI laboratory in the cloud that data scientists can working on at and for deploying the digital health or the application of digital transformation to medicine modern in that. So and the next layer is how to integrate the train model into the application that could be used for healthcare ecosystem, include the medical doctor, the patient, inpatient, outpatient as well, and distant twin object. Um, so the basic idea for personal healthcare is to provide for manage to manage the chronic condition for the people who want to take the health and wellness, and for the people who living independent longer for elderly people. So the basic that the business model that we are moving is to move this figure from stage of wellness, pre-illness and illness to this figure. So basically, when the people are getting out, so they keep their health, in the first stage of the wellness. So that's the objective of the system. And the system, the coverage or scope in here on the red color. So basically, usually the IT application go with the hospital, the clinical, that's the clinical application in hospital, and the in-person or offline in hospital between the patient and the medical doctors. But our system working on the online manner, so like the online hospital, and go with the people, work with the for the people who stay at home or outpatient. So that's the scope of the system. Um, so basically, for for the system that we implemented now is for we call it precision cardiovascular medicine, and right now we are collecting the data, real-time data from wearables of the people who can wear it at home or in outside of the home. And also, the data come from the hospital. We call it clinical data. But in the future, that we have to take a multimodal models. So the data could come from outside, like environmental data, and also from experimental data and biological data, like between the correlation between the gene and the disease. So it could be talk about the REWAS metric, could come for this side. So then when we have a different kind of multimodal data, we can go to the AI normal training and serving, like a feature engineering and taking algorithm selection, and go for development, modern development, and taking a evaluation process. And there, um, so that is uh, the thing that how AI could play in that the platform. And here's a very basic conceptual design of the system. If you can see from that, the the data the people are stay here, and it getting data from the watches and different sensor at home, and then go into the IT platform that I mentioned in the previous architecture, and then it can go to the back end of the platform. So here's we call a personal healthcare platform. So this system receives the data from real-time data from the people as a patient, but also from different data set, kind like clinical data, medication, genome data, environmental data as well. And it go to the different stage, as I mentioned earlier, of in architecture, like a data ingestion, a data lake, and go into this one. And basically train model is integrated into the AI microservice application in here, right? And then the AI, the real time, they come good to this one. So combining that's the input for the train model. So the output is for the patient, for the medical doctor can use the app and the web interface to see their condition for diagnosis and for treatment. So basically, you can see that in this distant twin view, so the medical doctor can work with the physical patient here, and also the object, the virtual patient here. So for treatment that can medical doctor have with the help from AI, he can make some kind of simulation with emulated patient here on the right side before making decision for real patient. So that important thing that digital twin can important, like trying without error within the physical patient before making a final decision to a particular patient. Um, so right now we have developed, you can see the interface, the kind of application interface is kind of snapshot that can be used for patient, for medical doctors, for different functionality of that. And so basically we can see that, so that's the ecosystem between the AI can support medical doctor, the AI can support the patient, and the medical doctor can work with the physical patient remotely, or can work with object like a simulated patient. So that is the different, that the uh, new hand care process with considering the digital transformation to the medicine. So what's the current status and vision of our team? You can see the last year we have a prototype working with smartwatch, and we working the data set with the heart disease from UCI in data set. And we work with different machine learning algorithm like a Pearson correlation coefficient and information gain, DBS scan, and XGBoot library. And this year we improved the algorithm and working in how to put the modern train model into the cloud. That important thing that so basically we have that we call zero point 0.7 release. And from next year we hope that we can um, develop we can collect more data apart from UCI dataset, like from Vietnamese dataset. So basically we work with National Hospitality of Heart Disease in Vietnam, and hopefully that we can work on that manner. uh, from point of view of AI, we will work on different approaches for running the AI model, like multi-modal data, real-time machine learning models, and meta-learning models. So, and then smartwatches integration, that we can work not only in one smartwatch, but also the other different smartwatch brands, like from Samsung, from Apple as well. So uh, big vision deployment for international user and Indonesia. So I hope that I have we have a chance to work with you and in the future, because I have been to in Bandung 25 years ago, and I hope that it comes again to Indonesia to work with you and in the future joint project. Um, so the vision is not only working with smartwatch, but also work with different data sources as mentioned before, like the pharmacy medicines, the medical records that uh, the patient taking during their treatments, and also correlation between the environment and disease. That's the topics that raised now that I'm working with different UK the team in here. That we hope that we can make a kind of a future correlation between the air pollution related to cardiovascular disease. um, Also from research, education, data set, and research could contribute to that manner. Like in UK, they have biobank, very big system. So whether we can make correlation between the genome and disease. So that is a very potential future for a personal healthcare system in general, and in our for particular for our system as well. So that is all of short a brief of what we have done, what we are doing, and what looking for the future for collaboration. Thank you very much.